We have with us Mr. Bill Gates, one of the world's leading philanthropists, needs no introduction. It's not always that one gets to speak to someone that doesn't need to be introduced. Mr. Gates, this is our second interview together. This time, more specific reason, you've written a book, How to Prevent the Next Pandemic. Now, this is a question that obviously everyone asks, but you've attempted to supply answers. Let me begin by asking you, are we out of this one yet?
No, we're not. We still have to make sure that particularly people over 50 get their booster shots. We'll have some additional waves as forms of Omicron circulate around the world. We hope that there's not another really bad variant, but we have to stay vigilant, looking at what's out there and keep that vaccination rate, including boosting, as high as possible.
Well, in a recent interview, you said, I don't want to be the voice of doom and gloom, but the risk of a more virulent and lethal variant emerging is way above 5%. Now, we haven't seen the worst of it. Mr. Gates, why is this such a real possibility?
Well, our understanding of variants, we have to do a lot more research. We were surprised by Delta, which of course hit India very hard. Then we were surprised by Omicron. And so we can't rule out what might come next. I think the chances of a significantly worse variant are fairly low. Thank goodness for the vaccines. That's an area where India played a big role, making a lot of the vaccines. That'll keep the death rate to be reasonably low, I expect. And yet, we do need to start talking about overall preparedness.
But more virulence, lethality, obviously seems to suggest that there is a degree of escapability that is inherent to COVID-19. How do you assess this going forward with the vaccines?
The fatality rate of COVID is actually fairly low. Overall, it's about 0.3%. And either, it would be very bad luck to have a variant that had a much higher number. That's not super likely. A future pathogen could have a much higher death rate. Smallpox, was dramatic, about 30%. And so, we have to be humble and study this a lot better and, have far better tools for the future.
I want to quote a little bit out of your book. You've written, the lower your excess mortality, the better you're doing. In fact, some countries, excess mortality is actually negative. That's because they had relatively few deaths from COVID. And there were also fewer traffic accidents and other fatal incidents because people were staying home so much more towards the end of 2021. America's excess mortality was more than 3,200 per million people, roughly on par with Brazil's. And you go on to write after that Canada's, by contrast, was around 650, while Russia was well over 7,000. Many of the countries with the lowest excess mortalities, near zero and negative. Australia, Vietnam, New Zealand, South Korea did three things very well in the pandemic. They tested a large share of the population quickly, isolated people who tested positive or had been exposed, and carried out a plan for detecting, tracing and managing cases that may have come across their borders. How do you assess the manner in which India has fared on this parameter?
Yeah, well, surprisingly, the rich countries have a higher death rate than almost all the other countries. It's kind of the U.S., Europe, and a few countries in South America, like Peru, have the highest. Now, part of that is the age structure. This is a disease that really a lot of the deaths are people who are over 60, and also working indoors makes it more dangerous for you. Overall, India did an amazing job not only making vaccines, but also getting them out to people. India has a better vaccine coverage than the United States has. The thing it needs to put the energy into now is that boosting for the elderly, but both the manufacturing and the infrastructure for vaccines, India was one of the best. The idea of which lockdowns were appropriate when, we're still digging through that, trying to understand, when schools are shut down, of course, there's a real cost to that. And so, I hope we can understand better when that tactic should apply and when it shouldn't. The entire world is a bit unclear about that.
Well, in this context of excess deaths, there's also been a very robust debate worldwide about the authenticities of fatality figures. Now, obviously, every nation has been accused, and I'm not pointing out one particular nation as having suppressed figures. Do you believe that this is a fair assessment, that nations have deliberately gone out there and suppressed figures, and can this actually be done in a democracy?
Well, I think the experts will be, figuring out those death numbers, for some time to come. At the basic scale of them, you can take, funerals and a variety of things and come up to a pretty rough number. There's always going to be some uncertainty. Our foundation, tries to make sure that things like, how many children die when they're young? How many children die of diarrhea? We try and help out with statistics just so we know which vaccines we need. But the death discussion is worth having. I think all the numbers I've seen, India's death rate is quite a bit lower than the rich countries, even though there's still some debate over what those numbers are.
Are you surprised by that, or do you think that this has been done deliberately? Because when there was an anomaly, it was called out almost instantly in the media, and that's why I came around to the fact that can it actually be suppressed? Can fatalities be suppressed in democracies that are quite open?
Well, India's always got vibrant debate. It's part of the beauty of the Indian democracy. So, people, I think, eventually will come to a consensus on those numbers. What's clear is, what can a government do? A government can get out oxygen centers, and I know Ministry of Health, worked very hard on that. Our foundation and some Indian philanthropists like Tata Trust and Piramal got involved in that. It can activate the manufacturers. We worked with Serum, and of course the government did. We worked with BioE, did great work, which the government supported. So for most of the things that are within the control of the government, India, stepped up on this one. And eventually we'll understand what the death levels were. But vaccination, mask wearing, those are the things that the only tools the world had this time. Even the vaccines weren't perfect, although they prevented severe disease and death. They didn't, particularly once Omicron came along, they didn't prevent reinfection. And so in my book, I'm pushing hard for a lot of R&D, which India will be a helpful part of, for a new generation of vaccines that have longer duration and that completely block infection.
We'll talk a little bit about that in just a few moments. You've described the American response to the COVID pandemic in 2020 as quote-unquote disastrous. I've got the exact paragraph out. Why do you say that?
Well, everyone expected the United States to set a good example. We have a strong set of experts in the Center for Disease Control, but we didn't move quickly to get diagnostics out, and so it spread throughout the population. The really positive exemplars in this case are countries like Australia, where even though they have a lot of travelers from China, because they worked with the commercial diagnostic business and they had good quarantine policies, they caught the disease very early. And so they have about 10% of the deaths of the United States So it's interesting to think, why were they better? Partly the earlier SARS-CoV-1 made them think about diagnostics. And so that idea of drilling in advance and practicing how you get out the diagnostics, Australia illustrates that's a best practice that we ought to get everybody to be good at that, to be ready for the next pandemic.
Let me quote something that's more relatable, closer home. And you've written, I admit to having been surprised, as many people were, by the size of the Delta wave in India in mid-2021. It was partly the result of wishful thinking, the mistaken idea that the country could relax because it had contained the virus in the early days of 2020. Another explanation is sadly ironic. Countries that do the best job of suppressing the virus early on will be susceptible to later surges. Can you explain this a little bit? Because it seems to be a bit counterintuitive.
Yes, if you have people who've never been infected, then they are more likely, when they do get infected, to get very, very sick. So, you have previous infection is protective, and vaccination is protective. And, the first variant we saw was Beta. That emerged in South Africa when the foundation was funding vaccine trials. That was only slightly worse. Delta was a surprise to us, and if you look at that, case curve, which we know because India was doing a lot of testing, it rose so fast, that was kind of unbelievable, and so a lot of people got infected with Delta. That's part of the reason India has had less of an Omicron wave, because you had good work on vaccination, and Delta infection slowed the spread. Many countries, Omicron has been there, like the Delta wave was to India, the Omicron wave was to most of the countries around the world. It's a unbelievably infectious variant, and hopefully the last word in terms of how transmissive this virus can become.
Indeed. What did India and the Prime Minister here, Mr. Modi, get right in their approach? Obviously, there was a very strict lockdown the first time around, and that mitigated the impact of the first wave, as you yourself have noted, but left us a little vulnerable. Now, could that vulnerability have been avoided? Could we have done something better so that we didn't have to really get hit the manner in which we did? And, those visuals still keep playing back in my mind. I mean, my own friends and family members and colleagues fell victim to it, so, it's left a big impression. Could we have done better between the first and the second?
It's when the bulk of your population is doing jobs, where you have to physically be present to do the job, it's not as easy as it is in a rich country where you have all these office workers who can just do, virtual meetings. And so, I expected before the pandemic that the death rates in places like India and other middle-income countries would be much higher than in the rich countries. It didn't end up that way, even if you take the higher estimates. Part of that was the vaccination, getting that out fairly quickly. Which lockdowns were appropriate, where more should have been done, I don't think any country's come to a consensus on that. India has multi-generational households. So that's tricky because you have young people out going around who might get infected, and then in that multi-generational household you get, spread there. The U.S. has that less. The U.S. has more elderly care homes, and that's a very sad story, that because early on we didn't realize, that it could sweep through those elderly care homes. A lot of the deaths, for example, in New York, were in elderly care homes, and in the future, I think we'll understand that, you have to diagnose everyone who's going into those homes so you don't get the disease spreading. So overall, the government did prioritize the disease. It's got in ICMR a lot of experts. So I'd say that our relationship with the various government agencies, we felt, everybody was doing their best job, very aware of this as a priority, willing to take some short-term pain in order to keep the death rate down. But if if the whole world had more dedicated people, if we'd practiced in advance, the numbers in every country should have been quite a bit lower.
Before I quote from your book once again, on a scale of 1 to 10, where would you rate India's response and the ongoing attempts at trying to obviously stall another wave?
Well, because that oxygen centers were put together pretty quickly and vaccination got done. In fact, India exported some of those vaccines once its needs were met. I give India 7 or 8. Of course, the pandemic is a tragedy. I don't want to play down in any way the deaths and the economic loss, nor do I want to say that the world as a whole was smart about this. Health experts, including myself, talked about it in advance, and we didn't really have dedicated teams of people. But given that, we had to scramble, if you look at those oxygen centers, you look at the clear messaging on vaccination. Unlike the U.S., you didn't get a political thing where one party says vaccines are good and another party says they're bad. Likewise with masks. Usually I think of the Indian democracy as kind of a wild west. In this case, I think the U.S. Was, crazy in that, you have a party, almost denying that the disease is taking place. And so, as far as I know, you avoided the politicization that, all the parties were saying, please go get vaccinated, and please wear masks. Lockdowns, there was good debate, and as I say, to this day, we don't really understand where we should have done more, where we should have done less. I do know that things like shutting schools down have a big cost. And so in the U.S., students who lost 2 years of learning, and it's going to be a decade before we can catch up on that.
Let me quote once again. What we need is a well-funded global organization with enough full-time experts in all the necessary areas, the credibility and authority that come with being a public institution, and a clear remit to focus on preventing pandemics. I call it the GERM, G-E-R-M, Global Epidemic Response and Mobilization. Tell us more about this fascinating plan that you've got going here. It's like the United Nations, really, of disease prevention.
Yeah, so there are tragedies like fire where we expect government to invest. So you have full-time firefighters, they practice all the time, you have fire hydrants around, and in fact, we've done a great job. The number of deaths from fires is going down over time because we take that seriously. Sadly, we didn't have pandemics on that list. We had, earthquakes and wars and tornadoes, but not pandemics. And so we didn't have a dedicated team. It's easy to make that mistake because pandemics don't come very often, but when they do come, it's almost the scale of a world war in terms of the global deaths and economic damage. And so what I'm suggesting is that this global team, GERM, connected with WHO, that making sure they stay focused on pandemic readiness, and that they're going to each country and saying, let's do a drill, like you do war games or like you do fire drills. My claim is that we can stop these outbreaks before they spread around the world if we have that global team working with all the different countries.
The WHO has been in some controversy. It's been caught up in some politics. Let's be honest about that. How do you rate the WHO? Has it lost some of its sheen? Do you think it still has relevance? Do you think perhaps they made a few mistakes?
Yeah, so many people think the WHO has a budget for pandemic work. And in fact, they have quite a small budget, and I'm suggesting we add about 25% to it, $1 billion a year for this new germ team. So if we rate the WHO based on what they're actually funded to do, I would give them also a high score, an 8 out of 10. If we rate them versus our imagination of what the WHO is funded to do, which we sometimes see in movies, all these people flying around from the WHO, maybe you'd give them a 2 out of 10. But that's not fair because we, the world, didn't give them those resources. And basically, that's my suggestion, is that we give them those resources. The main attack on the WHO is they got caught in a U.S.-China argument, where the U.S. was trying to make China look bad and China was trying not to look bad. And, the U.S., which I'm embarrassed by, actually quit the WHO in the middle of a pandemic. And so a lot of that is a sideshow, a U.S.-China sideshow, that really doesn't relate to something that WHO did or didn't do well. And I think, the leadership, Tedros and his team, tried to do the best to not get caught up in that controversy.
And press on. Just very briefly, which side of the divide are you on? Are you on the U.S. side? Do you believe that China could have done more to get China to, WHO could have done more to get China to be sort of more upfront about the origins of this virus?
Well, we have clear evidence now that the origins are in the meat market in Wuhan. They now have sequences and how it emerged over there. Every country that's ground zero delays a little bit. And so we probably lost 2 or 3 weeks versus a perfect response, but it wasn't some intentional conspiracy. By mid-January, we know the sequence, we know there's a problem, and we see that countries like Australia or the territory of Taiwan, they respond quickly, even though they have lots of people coming there from China, and they're two of the best, now that we look back. And so there was time to get ready. We're never going to have a perfect response by the country the outbreak's in, particularly if it's a very poor country. It could fester for a long time before we detect it. So I think the U.S. trying to cast blame on China, doesn't really hold up very well.
Doesn't hold up very well. Okay. Now, you've championed the Gavi Alliance, and it played a pivotal role this time as well in terms of export of vaccines to less developed countries. But as far as the global south is concerned, there is concern that the IPR regime should be further liberalized, that pharmaceutical companies should be allowed to manufacture generics to ensure greater accessibility in these nations. Why is that gap not being bridged to the extent that it should?
Well, the issue about COVID vaccines in particular has nothing to do with IP. The AstraZeneca, working with Oxford, invents a vaccine, and they call up every vaccine manufacturer in the entire world and say, we will help you make this vaccine. And so Serum, who is the world's highest volume vaccine manufacturer, with some financial support from the Gates Foundation, steps up and does a brilliant job. They made, I think at this point, 1.4 billion vaccines. So everything about COVID vaccine availability, which we now have more supply than we can use, those first 6 months of 2020 of getting the information out and helping manufacturers, that's much better than free IP. That's literally going to the factory and helping. In general, IP for medicines is a very complex issue, and there are cases where lower prices or more flexibility should be there, and the foundation's an advocate for that. But in the case of COVID vaccines, IP was not the thing that held us back.
How do you overcome the access to vaccines hurdle between the global south, the global north, the rich, the poor? How do we do that?
Well, we should recognize that we don't have health equity in the world. If you get some rare cancer, in the United States, very, very expensive treatment is going to be made available to you. And even in India, you don't have all those things. And then if you get to, Nigeria, it's much worse. And so the sad fact is that health is very inequitable. Reducing that inequity is the primary purpose of the Gates Foundation, to get vaccines to all the world's children, and to have children everywhere be able to not risk death. And we've gotten the death rate down from 10% of children under 5 down to about 5%. Of course, in COVID, again, who had the incubators? The rich countries. Who got early access to the vaccines? The rich countries. India is somewhat of an exception to that because of its domestic manufacturing. And so if you're an old person in Africa or South America, if you see young people in other countries getting vaccines, you can feel that's inequitable, because your risk, because you're old, is much, much higher than that young person. And yet, politicians in the United States, we're not going to say, okay, we're denying vaccines to the entire population because we're prioritizing elderly in other countries. The way to beat that is to be able to make enough vaccines a lot faster, and so we don't have this terrible allocation problem, which is hard because we don't have global government, and rich countries tend to budge to the front of the line.
They do. A couple of questions, my last two questions, Mr. Gates. What has the epidemic taught us about transparency, and do you see any trends emerging about how democracies and autocracies respond to it?
Well, you have this paradox that countries like China can actually enforce quarantines in a more strict way than any democracy. Now, that it's not, a free lunch, people are being imposed on, but their ability to enforce quarantines is, way beyond what the US or India can do. And so they were able to take the original variant and essentially stomp it out. Now that we have this super transmissive Omicron, even for them, they're having a hard time stomping it out. And there's no chance that the US or India could stop Omicron using lockdowns. You have to have almost perfect behavior to stop that spread. Democracies, on the other hand, are better about debating, what should we do, what should we not do. And, I'm super pro-democracy, so, I see benefits there. But people do find it interesting that autocracies, there's at least one area of collective action that their enforcement, did save lives in that first wave.
My final question to you, and I'm not going to impose on your time any further. Would you say that we're currently in a better position than we were when we faced the first onslaught of COVID today to deal with a similar epidemic or something slightly more different?
Yes. Now we're aware that this is a huge problem. I think there's more we need to do. We need to debate this germ idea and come to consensus on that, get it well staffed. That could take us 5 years. We need to invent the new tools. That could take us up to 10 years. But yeah, we're not, humanity is smart enough that when a tragedy takes place, some of the smartest minds think, okay, let's compare, which countries did particularly well, particularly poorly, what tools were we missing? And so, although this pandemic is tragic, it should have one positive result, which is that we take it seriously and make the investments, which are very modest compared to the damage of a potential future pandemic, and really get ready like we are for other disasters.
Thank you very much, Mr. Bill Gates, for giving us an insight into your brilliant mind. Thank you very much. Thank you for the book.
Thank you.